Hi, President Davidson here with another Roadrunner Rundown. And today we want to talk a little bit about mental health. I mean, it's the end of the semester, things already start to get weird. Add to that the pandemic and what's going on with politics in the world. And I think it's really time for us to pause and think about how we can take care of ourselves. So joining me today are Richard Michio and Annalisa Wick, and they are from the Aurere Health Center. Now, Annalisa is a psychiatric nurse practitioner, and Richard is a licensed clinical social worker. Together, they've been working on some programs to help our Roadrunners. All right, so Richard and Annalisa, why is it so important now, especially, to be thinking about our mental and actually our physical health?
Absolutely. So at this point in time, of course, we're at an extraordinary convergence of both stressors and unprecedented barriers on social connectedness. And so kind of what we're learning is we're getting national data to back up what is palpable to all of us, which is that there are profound increases in emotional suffering, depression, anxiety, and suicidal thinking. And one reason that we're here is out of concern for our campus community, because when we look at our numbers at the health center, there is not a significant increase in numbers of staff, faculty, and students who are seeking psychiatric care. So essentially, we know that the need exists, and we're here to really try and bridge that gap.
So what you're saying is, statistically and across the country, we know that there should be a greater demand, but you're not seeing it at your actual health center.
Totally. And you know, there are a few reasons that can happen, many different reasons. First is that we really want to do our best to normalize and destigmatize.
I think one of the biggest things is we know traditionally 2/3 of individuals who are struggling with mental health concerns and issues don't seek out treatment or don't know where to go or don't know how to access care. And so here on campus for our faculty and staff and our Roadrunners, the Health Center at Auraria, we have psychiatric services. We collaborate a lot with our Student Counseling Center. The MSU Denver Counseling Center is primarily for students, but they offer consultations for faculty and staff.
Right. So what sort of tips could you give for folks that are just feeling a little blue, or to prevent the blues, if you want to call it that?
So I would say one that's pretty important and difficult right now is social connectedness. We have to get so creative and be intentional on a day-to-day basis. And it does make a difference. We know that social connectedness is good for our stress hormones. It's good for immunity. We really cannot disentangle mental and physical health. So that one, movement for sure, which we all know. During this time, I would just encourage everyone to be gentle with themselves and do what you can.
So talk a little bit to me, Richard, about what you're doing with the HR department to get the word out and everything else.
Sure. I think, faculty and staff spoke up, and HR is teaming up with individuals from the staff senate, with our marketing team, and they reached out to us at the health center to kind of contribute to some of this wellness and overall mental health support for faculty and staff. Over the course of the next month and a half or 2 months, members from the mental health team within the health center at Auraria are going to contribute some articles to the Early Bird around different aspects of mental health, looking at what you were asking about earlier, what to expect when going into treatment, how do I find treatment, different topics around burnout and resilience. We tend to think that mental health is a standalone entity, but we know that there are a handful, if not more, factors that contribute to how we function on a daily basis. And our goal is to introduce those different factors, the pillars of wellness that we'll be looking at over the course of the next year.
Thank you, Richard. Thank you, Annalisa. Thank you for what you're doing for our community. So that's it for the Roadrunner Rundown. If you have any other questions, we have a lot of information on our Roadrunner Safe Return website, and take a look and watch out for the articles that are going to be coming out. See you next time.